Welcome to SMTV's last newscast of the year. Today we'll showcase the challenges students face regarding mental health. All that and more on this episode of SMTV.
From the Chuck Scarborough Television Studio on the campus of the University of Southern Mississippi, this is SMTV News. News you can use.
Welcome to this week's episode of SMTV. I'm Madison Hatton. Our special Silent Suffering USM's Mental Health Crisis will showcase all aspects surrounding mental health at universities around America. For Southern Miss, this issue is no different. These are real students with real troubles. Kyra Lampley, SMTV, brings us the story.
Good evening, USM, and welcome to an SMTV special report. Over the years, our school has seen countless battles against adversity. Many have been long-lasting struggles to fight against injustice and inequality, but currently, our university is facing a crisis that lurks beneath its surface. The issue of poor mental health affects countless USM and Hattiesburg residents. Our special dives deeper into this crisis, uncovering the emotional truths of students, advice from mental health professionals, and resources available for help. Join us as we uncover the silent suffering of USM's mental health crisis, and we hope your voice is heard.
Pretty much the only explanation for why it was taking so long is there's a long wait list, and what they do takes time, and they didn't have enough workers in there to really go through it.
Patterson White is not alone. Every year in the United States, thousands of college students struggle with their mental health. According to the American College Health Association, almost 3/4 of students in 2021 reported moderate to severe psychological distress. In fact, Mental Health America ranked Mississippi 25th out of 51 states in terms of prevalence of mental illness and access to care. Experts view Mississippi as a mental health desert, with 540 people to one mental health professional. This, in part, trickles down to college campuses in the state. College is a stressful time period for many because it is a significant life change. Students are exposed to a world without parental control and a world where they are in control of their own fates. However, this newfound freedom can be overwhelming. Students at the University of Southern Mississippi are among those struggling to adapt to their new world. With tight class schedules and managing both professional and interpersonal relationships, the expectations for students today are high. Students such as Brooke Anderson and Trey Baldwin are among those who struggle with these issues.
I would definitely say probably feeling like I wasn't good enough for my academics, especially being a biomedical major trying to go to medical school. You feel like you always have to have all the straight A's. All the GPAs have to matter because we have to depend on 2 GPAs. So always making sure that it's nothing less than perfect can be very, very hard. But now I've given myself a little more grace and understanding this is new material.
Self-esteem, I'll say that. Self-esteem for just confidence in certain areas. Some places I'm lacking, some places I'm not. Just trying to realize, work on my weak points, continue to work on my strong points, stuff like that.
Jessica Burain, a Jackson representative for the Mississippi Department of Behavioral Health, says classroom success is something that her patients stress about daily.
Everybody wants to succeed at school. You want to do your best, specifically certain, I would say, fields. Start like social work, for example. Certain colleges don't even allow you to have a C. You're out of the program.
USM senior Ariana Walker can attest to this. She says her mental health is a daily struggle.
But towards the beginning of the day, I definitely have my depressive swings, and I've been feeling my anxiety again. There was a time where I was really didn't let anything bother me, but it's starting to come back.
Compared to different universities around the state, USM counseling services is simply inferior. Currently, USM has 5 counselors and 4 staff members for 14,133 students. Mississippi State has 6 counselors and 10 staff members for over 23,000 students, and Ole Miss has 11 counselors and 15 staff members for over 24,000 students. There are more students seeking services and not enough counselors.
I think it'd be great to have more. I think that, the more staff we have, the more we would have a chance to serve more students. I think that we have been able to do a lot with who we do have on staff, but certainly I think it'd be beneficial to have more staff.
Heidi Nelson, the director of student counseling services at USM, declined an in-person interview, but she answered pre-approved questions through email. When asked on how wait times vary from student to student, she said that there has been no wait list since 2018. Nelson declined to answer questions regarding whether or not the student counseling services have been provided with enough resources from the university. The staff at USM may be at a disadvantage, but the fact remains that students such as White still manage to fall through the cracks.
Yeah, so basically from the day I put my name in on the wait list up until the day they actually called me to schedule my first appointment, it was about a year in between those 2 dates. And within that time, I called them 3 or 4 times, every few months just to get an update on, where I was on the wait list, if they had forgotten about me, because in between all that I hadn't heard anything from them. And so I called them and asked for updates, and what I got was, you're still on the wait list and you should be coming up soon. And that's pretty much all I heard from them in that 1 year period.
There are many just like White still waiting. In Hattiesburg reporting, I'm Jackson Howell.
A wide range of mental health issues comes with a wide range of causes, whether that's stress from school, issues at home, or even small buildups of pressure over time. Understanding the problem's root could give students at USM a better angle to attack it. Nathan Lee reports.
Mental health has come to the forefront of issues that plague the world today, and people are starting to take notice. We have recently seen prominent figures like Selena Gomez, Ryan Reynolds, and even Dwayne "The Rock" Johnson come out discussing mental health problems they have faced in their lives. This shows that anyone can be battling mental health issues at any point of their lives, no matter the fame or money. Right now, one group of people that face some of the most mental health issues is college students. According to Mayo Clinic Health, up to 44% of college students have reported symptoms of depression and anxiety. Another Mayo Clinic statistic shows that as many as 75% of students who struggle with depression and anxiety are reluctant to seek help. This raises the question to why a high percentage of college students are facing mental health problems and what are the causes for these issues. Southern Miss student Jane Claire Fort talks about her battle with anxiety and how other people may feel that are dealing with similar problems.
I feel like it's very much still stigmatized. And especially in the South, I know I grew up in a family that was like, if you're struggling, we don't talk about it, we face it and we get over it. And that was the game plan. And I felt extremely isolated, and I felt like I was the only person in this world that was struggling really bad with my mental health. And I think that's something a lot of people face, because when you're going through those bouts of anxiety and depression and that panic-ridden feeling all the time, you feel like it's so difficult to do everyday tasks.
Southern Miss students like Fort are starting to come out in droves to talk about their own issues and how the university did or did not help them. Some similar mental health issues that college students deal with are depression, anxiety, suicide ideation and intent, eating disorders, and substance misuse. In a 2021 Healthy Mind study, 22% of college students screened positive for major depression and 41% screened positive for depression overall. Students at the University of Southern Miss have given mixed reviews on the results from the university's student counseling services and Center of Behavioral Health. Fort talks about how the university helped her on her journey.
Like I said earlier, they were really great with working with me with my schedule, but I think that's really all they contributed, which was great. Like, I really needed to be online at the time, but I think kind of offering and talking about the services USM has more, to me, would have probably been more beneficial, because at the time I didn't really know any of the counseling services options that were available, and those really weren't communicated with me. So I think broadcasting that more would have been more beneficial during that period of my life.
Fort's experience is different than other students that attended Southern Miss, as former student Rosemary Pinella talks about how the Center of Behavioral Health helped her tremendously.
So the behavioral health clinic, in no uncertain terms, quite literally saved my life. My therapist at the time really picked me up off the ground. There was a lot of good communication, and she was somebody I felt like I could be really honest about what was going on in my life and everything.
The Center of Behavioral Health helped Pinella get back on her feet as well after she got out of her mental health crisis. These cases show the wide variety of help the university can bring, but why are students still dealing with these issues? In a study from Frontiers in Public Health, it indicates some of the most common factors to why college students are struggling with their mental health. These factors are academic, social, psychological, lifestyle, and physiobiological/genetic factors. While students can face all of these causes in college, academic stress and the frightening reality of taking on more adult-like responsibilities are some of the most common among students. Southern Miss student John Benet Kepper talks about the struggles of juggling all aspects of college.
In my head, I'm thinking, I don't have a break, and I have this so-called academic guilt, I guess you could say, because in my head I'm thinking, you have this assignment to do, and then a test as soon as you come back from break on Monday. So there was just no rest mentally, maybe physically, but not so much mentally.
Students like Kepper exist all around campus, not knowing how to deal with these thoughts. In a survey conducted by the National Alliance of mental health issues caused 64% of students to drop out and not pursue their degrees. The study also revealed that 50% of students that dropped out did not access mental health services. While you can correlate many things as a cause of mental health problems, one thing that universally does not improve mental health illness is the reluctance of getting help. Fort once again talks about her experience and why she thinks some people are unwilling to get help.
So I think a lot of students struggle with, one, talking about it because we feel like a lot of people don't understand. But what I've learned through the past couple of years is that pretty much everyone has a struggle, whether it's mental, physical, whatever it may be. While we're not all similar in those struggles, we can relate to each other.
Understanding that you are not the only one dealing with problems is becoming a more consistent feeling among students at Southern Miss. Still, there are students and people everywhere that will not be able to relate to that feeling due to the stigma that followed mental health for years. Now, though, people are starting to break from that mold and are unafraid to express their feelings to others if that can help them. Pushing this narrative can set an example for the youth and people that do not know how to counter mental illness. Students like Rosemary Pinella and Jane Claire Fort are some that can say they have been through the worst times, but still recognize that mental health is a marathon, not a sprint.
I think I've come a really long way, but it's never something that comes to an end. It's always continuous.
I'm Nathan Lee, USM Reports.
Regardless of the reason, the USM community certainly has a need for mental health services, but the financial burden of seeking help is sometimes too much to bear. So what options are there for getting help if having the money is the most biggest concern? Charlie Luttrell reports.
Seeking help is one part of the process, but finding the right financial option for mental health services is one of the biggest obstacles, especially for college students. For senior biological sciences major Patterson White, cost was the leading reason he chose to sit on a wait list to use one of USM's mental health care services, the Center for Behavioral Health.
The prices for what I was looking to get done were tremendously cheaper doing it through the school rather than going to a off-campus location. And so I didn't really explore anywhere else because I knew that the saving money was the main reason that I was going to do it through the behavioral health clinic.
The National Council for Mental Well-Being reports that nearly half of the American population rates finances as the top barrier in receiving mental health care. USM provides solutions to students looking to ease the financial burden of these services through the CBH and student counseling services. The CBH charges students on a sliding scale, but at a rate that can be much lower than what students could be paying off of campus. White said he paid a flat fee of $200 after his first visit that covered his following appointments for the semester. and students can access SCS for up to 8 free counseling sessions per semester.
Any services that you would get from us, you've already paid for by paying your tuition. So none of the resources that we have or services that we provide in-house cost a dime. We do have the ability to refer out to other resources on campus or off campus, but we always make sure that students are aware if there's fees associated with that.
But the story can be much different for students looking to get help off of campus. Some sessions can cost around $190 an hour for private coverage, and students have to deal with finding facilities that accept their insurance. Casey Johnson started his private service, The Garden Counseling, after working as a counselor at SCS. Johnson has seen students able to find coverage off campus, but makes it a point to refer people back to SCS if they cannot get their services covered.
Students, don't have insurance that will cover mental health services, and student counseling services and for those people is a much better deal, being that it's free confidential counseling for currently enrolled students on campus. But then there were a few who have insurance, and it wasn't that big of a financial commitment to come over with me and see me off campus.
According to the White House's Council of Economic Advisors, half of adults find their health insurance does not adequately cover mental health services.
I know that a lot of the time for insurance policies, mental health benefits are different than regular benefits. So where it covers if you go see your doctor for a cold, it might not for counseling. But every policy and every insurance company is different. So that really depends on how the patient is covered as far as what they'll pay for different services with us.
An insurance agent, Chase Norris, said that most plans are network-based, meaning students must have in-network providers to cover their services.
They are network-based. If they're out of network, they're not going to cover it. Very few plans now are, they call it a PPO, where you're able to go in and out of network. You'll have a higher cost if it's out of network. They've gotten away from that.
Some students have been able to find services that adjust rates to their situation, but many may have to pay higher rates out of pocket. White advised students if their primary concern is cost, the simple route is to go with USM, but White said be prepared to wait to get into CBH. He waited a year before his first session. CBH Director Christy McCraney declined a request for interview.
If you want to save a lot of money, do it through the USM Behavioral Health Clinic, but you better get on the wait list early.
This has been Charlie Luttrell for USM Reports.
With financial aid to students and residents who qualify, the services offered at USM fits the bill. The more pressing concern, however, is if the university has the resources needed to help every student who needs treatment. Heaven Brown reports.
According to the university website, there are 5 mental wellness counselors and 4 staff members working at the Student Counseling Center at USM. There's an estimated 1,100 students that see SCS counselors yearly. If you do the math, that's around 220 students per counselor. Heidi Nelson, the director of Student Counseling Services, declined an on-camera interview mainly due to staffing issues within SCS. She declined to answer if she felt the university provided enough resources for her office. In an email reply, Nelson said, quote, "Our scope of service is on par with most college campuses where we deliver both individual and group therapies along with crisis intervention and referrals. Though having more than 5 wellness counselors on SCS staff is desirable for assistant directors like Amanda Kirtland."
I think it'd be great to have more. I think that, the more staff we have, the more we would have a chance to serve more students. I think that we have been able to do a lot with who we do have on staff. But certainly I think it'd be beneficial to have more staff.
In any case, workloads like these are stressful for many, like former SCS counselor Casey Johnson.
I think a lot of clinicians would say that, that it does get stressful and overwhelming managing things like on-call and higher incidents of safety concerns on their caseload.
William Clark is a senior psychology major. He started as an engineering major, but changed his career path to psychology as the need for more mental health professionals became apparent during the pandemic. He sees the need for more resources within SCS.
I'd say overall it has been good, but it could be better. I think that obviously we could use more staff members.
But according to SCS officials like Amanda Kirtland, counseling services are already operating efficiently. According to SES officials, there is no wait list.
I've been with the center for just shy of 7 years, and I don't think we've been on a wait list since 2017.
At first, I was kind of discouraged because I heard they had a wait list and that the wait list could take months at a time.
The expectation of delays in mental health services is a barrier for many students. For those like Asa and Pika, hearsay caused them to not seek services until this semester. They received correspondence from SES within 1 week of requesting counseling.
And then this semester, I actually reached out and I realized it wasn't as difficult as they made it seem.
John Benet Kepper is pursuing her second bachelor's in an accelerated nursing program. She used SES during her first stint as an undergrad. Kepper believes that more visibility and promotion could help students know about resources on campus.
Being out in the community more would be a thing that would help more students feel more comfortable seeking help and learning more information about what resources they have to offer.
Kepper remarks how much counseling has equipped her to manage her mental health.
Even if I hit a moment where I'm in a low again, I know how to better help myself, and I don't feel as negatively towards going to counseling and feeling bad about it.
Even in Johnson's private practice, he makes a concerted effort to direct students to free resources.
I make it a point to refer those people back to campus because, I mean, one of the biggest stressors for students is finances, and if they can access free counseling services, that's a big deal.
Students can reach out to SES in 3 ways. They can call them, they can email them, or they can complete a form online. Other resources on campus have also filled in the gap at USM. The Center for Behavioral Health and the Center for Family Therapy are similar counseling services available to the USM community. Heaven Brown, USM reports.
Mental health care on campus certainly provides a range of options, but if on-time help can't be found at USM, our community has a variety of options worth looking into. Wade Taliansich reports.
The USM, Hattiesburg, and Pine Belt community is facing a mental health crisis. For its residents, the problem is an ongoing battle, and for people like 32-year-old USM alumnus Chris Evans of Terry, this issue is dire. Shortly after leaving USM and entering the workforce, Evans began to develop depression and alcoholism from an overbearing workload and zero free time.
And I just looked at my wife and I was like, I don't want to live anymore.
Evans knew something had to change. So after one last night of talking with friends, he checked himself into the hospital.
Scariest thing I've ever done. But the experience at Pine Grove was great because I turned off from the rest of the world.
Pine Grove Behavioral Health Center is one of 134 mental health institutions in Mississippi. Child and adolescent psychiatrist Dustin Baker worked for Pine Grove during his training at the University of Mississippi Medical Center, and he says services such as Pine Grove's use evidence-based treatment to help the individual.
Not only would they be providing the medication management side of the equation via like a psychiatrist, they would also have that person in group and family type therapy so that they're working on those individual skills that led to the person having a problem in the first place.
Over 7 days, Evans got the help he deserved, understanding his need for extended treatment, which led him back to his alma mater for minimal cost therapy with USM's psychology PhD students. Though he liked the service, he was unable to continue due to the severity of his case.
Unfortunately, your situation is beyond the scope of our department. And so I'm not going to be able to continue as your therapist. Is there anywhere else I can go without money? And the answer was not really.
USM Mental Health Care offers helpful, low-cost service. But according to Triani Richardson, a junior therapeutic recreation major from Pascagoula, the availability is inconsistent.
When I was trying to get all of my financial aid and everything straightened out, and I was going to the counselors just for a positive word and stuff like that, sometimes they would give me exactly what I was looking for, but other times they was giving me the runaround.
Though Richardson's situation wasn't dire like Evans, she still deferred to alternative methods of therapy outside of USM. Richardson uses an online crisis app to talk to her therapist through Zoom, which she claims to be the more convenient option.
Just communicate with me back and forth that she's available at this time and this time versus no respond back once I come on campus, then it's, yeah.
Her employer Target also offers mental health care benefits to all U.S. employees, and that financial access is key in seeking help outside of USM. Haley Green, the assistant manager at Hattiesburg Clinic Connections and Psychology and Counseling, agreed.
As far as the state in general, there have always been less resources, it feels like, than what we would ideally have in the mental health field.
According to Mental Health America's 2023 United States Stat Report, Mississippi ranked 42nd of 51 for access to care. That said, the results of Connections treatment seem positive to Green.
We have to go by what our patients say, and we have heard many stories of people that have found us tremendously helpful, and, at the end of the day, that's all we're here for.
Since no financial help was initially available to Evans for extended care, he started slipping back into his old habits.
You put a frog in water and you slowly turn up the temperature until it's boiling. The frog never realizes that it's about to boil and be cooked to death because the temperature is changing so slowly.
Despite having a new job in 2021, the isolated conditions from the pandemic left him feeling trapped. With no other escape, he drank all day, stopped eating, and couldn't even get up to use the bathroom. Thankfully, Evans discovered that his new position offered a no-copay mental health service.
If I had even had to pay a percentage of that, I wouldn't have been able to go. I wouldn't have had the money.
His job's coverage certainly saved his life, but unfortunately, his story echoes many others in the state. According to the CDC, in 2019, at the time of Evans' first crisis, 436 Mississippians committed suicide. But the hope for more discussions and care for mental health remains, Evans says.
And now that we've all collectively agreed to that for the most part, I think we need to address it by making these resources more available.
Wade Taliansich, USM, reports.
Regardless of the struggle, hope for the USM family remains. Whether your situation is severe or not, your mental health matters. And if any of these resources appeal to you, visit our webpage at www.silentsufferingforsix.wixsite.com for more information. Thank you for joining us and working to create a healthy future for USM, a future where no one suffers in silence.